I'm Dr. du Plessis, Dr. Anne-Marie du Plessis. I work for SCP Radiology as a private radiologist.
My name is Anzell Avenant and I am a qualified radiographer at SCP Radiology.
So people would come for a bone density scan typically in two scenarios. An older woman who has minimal trauma and develops a lumbar fracture to see how, or if she has osteoporosis and what the degree of her bone density is and whether she requires treatment. And the second scenario would be as a screening examination for usually people with a history of osteoporosis in the family, and then patients with chronic illnesses such as rheumatoid arthritis or cancer. So people who are on chemotherapy or on steroids for the chronic disease to see whether they've got low bone density.
So the machine we use to do bone density scans is almost like an X-ray machine, but it uses very low dose radiation. The scan is non-invasive and painless, and I am present in the room during the examination. In general, for the scan, we only scan the hips and the lumbar spine. For the hips, the feet will be securely strapped, and for the lumbar spine, we will put a cushion under the knees to straighten the back.
It often happens that you see that in a lumbar spine that the bone density is osteoporotic or low, and normal bone density in the hips or in the wrists, which are the typical 5 positions that we take bone density at, so wrists, back and hips. It's not a determination of, you don't treat a patient for the back or his pelvis, it's a global treatment. So if you have osteoporosis in one site, it means that you have osteoporosis even if the bone density in the rest of your body is normal. You're at risk of a major fracture, so a lumbar fracture or a pelvic fracture with minimal trauma, and you need treatment.
Preparation for the scan is to discontinue any calcium supplements at least 24 hours prior to the exam. It's also very important that the scan should not be done within 10 to 14 days of any previous contrast-related studies.
If you have osteoporosis, typically you're going to need medication to increase the density of your bone. If you have low bone density, it might just be a lifestyle change that you need to eat more protein, more calcium-rich foods, more leafy greens, which we all love. So it might just be a dietary change. Or how we follow up with bone density is a patient would typically come back after a year of treatment or dietary change or lifestyle change to see whether there's been an increase in the bone density. So it's actually just a follow-up.